Start this. So, morning everyone. My name is Shazia Khan, and the unit we'll be doing today is unit on effective communication in health and social care, and we'll be doing learning outcome 2 today. But before I go into learning outcome 2, I just want to give you a recap of what we did in the last learning outcome, which was learning outcome 1. In learning outcome 1, we looked at understanding communication approaches used in health and social care. We also looked at what are the reasons for communication. So within health and social care, why is it so important to have communication? So, like things like providing people with information, families, maybe other professionals. What are the main reasons why people communicate? Obtain information, to look at people's feelings and preferences. We looked at what effective communication was and effective listening techniques. And we looked at verbal communication, non-verbal, written, technological, and visual, which we'll be looking more at today as well. We looked at person-centered communication. We looked at elements of being culturally aware and sensitive, and confidentiality quite in a lot of detail. We also looked at explaining the importance of effective communication in health and social care. And we looked at elements of such as like building trust and enhancing team collaboration and making sure that we're promoting a person-centered care and ensuring safety. So we looked at them elements in regards to learning outcome 1. Now we're going to go on to learning outcome 2, which looks at elements of understanding the communication needs and preferences of individuals. And that's really important to identify. So we're going to look at the indicative content for learning outcome 2, which is to determine individuals' communication needs. So observation, agreement, liaison with families, relatives. Approaches used when promoting effective communication. Again, we'll look at verbal, non-verbal, formal, informal, the use of interpreters, the use of certain aids, and then we'll look at services and resources access to promote communication, like speech and language therapists, group networks, and GP or audiologist. So, trying to understand why an individual's communication needs. Why do you think it's so important, Esperance, to understand someone's communication needs? Do you think it's very important in health and social care? Bida, do you know why it's important to understand anyone's communication needs? Okay, so it's really, really important to recognize how someone communicates because, you need to take into account things like their language, their style of communication. You need to identify their needs as well. Maybe they're disabled or anything. They may have special needs as well. You need to make sure that you are person-centered and you have an individual approach. You may establish communication methods by choosing the right method for that individual. And, you need to make sure that they understand what you are saying. You need to make sure you are, connecting with that person and allowing them to tailor their communication approach effectively around them. So that involves things like, actively listening approach to connect, listening, clarifying questions, and adapting the message to that individual's needs. So it's really important. So effective communication, individual communication needs and preferences can vary widely, including their preferred method of communication. So it might be for some people, it may be, written, verbal. It may be, it needs to be more clear. It may be that whether they require technology for it, if they've got a disability. You have to adapt the communication needs to the preference of the person, and you need to make sure you are, again, when we look at effective communication, you are listening to what the individual is saying. And active listening is a big part of any communication. Why do you think listening to someone is really important? Anyone, Vida? Esperance? Why do you think listening to someone is so important, active listening? So you're able to understand that person's communication. It helps you, if you're listening, you're able to understand that person, you're able to ask appropriate questions. Also able to help provide the most appropriate support for that person if you know what their communication is. If you're able to communicate with them and what their preferences are, you are able to provide them appropriate support, and you are able to, make sure you adapt to the approach they find easy to do. There's no point using an approach that they don't understand. Sorry, okay, Vida, that's okay. That's okay, thank you. Yeah, so it's very, very difficult in that situation sometimes if you don't find out what the individual's way of listening is. You need to be, it needs to be clear communication, and it needs to be concise and respectful. It needs to involve verbal, non-verbal, or written cues. So effective communication helps the patient receive the highest care standard. And it also helps build that trust and encourage any sort of open dialogue between you and the patient. So you need to make sure that, within the health and social care, it's clear. It's a clear message that's been exchanged between patients. Maybe it may be patient's family, it may be other care professionals, and it's a key and fundamental part of the quality of care you provide to that individual. You need to make sure that also that, it's, you make sure that it's to do with patient care, patient safety and satisfaction, and it builds this element of trust. So you need to make sure that you have got effective communication and you are listening. Listening is really important for the individual. So here's a video, and this video looks at communication. So let's talk about communication, and it's speaking to people with a learning disability, how their psychological attributes are, what their beliefs are, what their behaviors are. And it's really important. So have a look at the video in your own time. We've got theories of effective communication. So there are theories of effective communication that focus on the messages and focus on, different types of communication and why it's so important in regards to understanding the final goal that you accomplish at the end of it. And influencing people's thoughts, feelings, and behaviors. And the first one that we're going to go through, the types of community, linear, you've got interactive and transactional. The first one is the linear model. Esperance, can you hear me? Yeah?
Yeah.
Oh, okay. So the first model is the linear model, and this model of communication, it actually refers to a communication model that portrays information transmission as a one-way process. So where a sender encodes a message and it sends it directly to the receiver without any feedback loop, essentially viewing communication as a straight line from the source to the prominent examples. And they include things like, Shannon and Weaver's model and Laswell's model and Aristotle's model. So, this is where the sender encodes a message directly to a receiver without any sort of feedback loop. It's a straightforward communication model that's used across businesses to assist customer communication driven, such as marketing, sales, or PR. So this is one of the models. The next one is the interactive model. And this model is a model, the interactive model is a two-way process that depicts communication as a cycle, sending and receiving messages. It's a non-linear model that prioritizes engagement and feedback. So how it works is the sender sends a message to the receiver, who then responds with feedback. And then the model considers that the physical, psychological context of the communication and adaptation messages are adapted based on the feedback, making communication more dynamic. So an example could be that it could be a phone conversation is a basic example of an interactive model. Using an ATM is another example, as you provide your card details and receive messages from the machine. The benefits of the interactive model is that it makes communication more engaging and lively. It also allows for a back and forth exchange, unlike the linear model, which is a one-directional. And they are within the linear model, within the model, there are three roles of communication, as we're mentioning: transmission, interaction, and interaction models. The next one is the other interactive models are the SCREMS models. And the SCREMS model is developed in 1954 and is considered a key example of interactive communication model because it portrays communication as a circular process where both the sender and the receiver actively participate, exchanging roles and providing feedback to one another. Unlike linear models that only viewed communication as a one-way flow from sender to receiver. Within the SCREMS model, communication is depicted as a continuous loop where the sender encodes a message to the receiver, decodes it, and then sends feedback back, who can adjust the message accordingly. The SCREM model emphasizes the importance of sender and receiver having overlapping experiencing and understanding to effectively communicate with one another. Both the sender and receiver actively encode and decode, which can lead to potential misunderstanding based on individuals' interpretations. So sometimes it works, it's a good model, sometimes it doesn't, but you know, the models are there to see which one works for you best. Transactional model. So this transactional model of communication views communication as a dynamic, ongoing process where both participants simultaneously act as the senders and receivers of the messages, constantly adjusting based on feedback and considering the social, relational, and cultural context surrounding the interaction, essentially meaning it's created collaboratively in real time rather than simply transmitted from one person to another. An example of a transactional model of communication is negotiating a contract between two parties is an example. Skype calls, phone calls, chat sessions, and face-to-face encounters are other examples. There are a number of interrelated processes and components in the transactional model. These elements consist of, as we mentioned, encoding and decoding the communicator, the message, the channel, and the noise. The transactional model of communication includes encoding and decoding of non-verbal information as well as a real-time feedback. Even the most commonplace conversations are covered by models of communication. When it comes to things like public speaking, the transactional model can be utilized as a guide to better comprehend the process. So there's different models used, you know, and these different models help, you know, communication better for certain organizations. And the whole point of it is they're trying to improve the communication barriers so that there's no breakdown of communication. So you can explore the different models further through further sources. So you've got the communication process, and the communication. These are some references that you can use. And you know, you need to make sure that you're trying to determine what a person's communication preferences are, because this allows you to, you know, be effective and respectful, you know, and ensuring that information is conveyed properly to one another. There's an activity there that you can do in your own time. So think about a situation where you have communicated with someone. Analyze your communication by applying the 7 C's and identify what you could have done better. So you're looking at the element of the 7 C's. So you're looking at correctness, clear, concise, concrete, considerate, and complete, and courteous. So look at them in relating to an example that you could use. So the next one is looking at explaining the importance of determining an individual's communication needs. Unless you know someone's needs, it's really important that you promote, you are able to identify that, because understanding a person's needs helps us provide the most appropriate support. And especially in health and social care, it's really, really important. Working in a wide range of settings, it's important we identify how to best communicate with individuals and adapt our approach to. Do you think, Esperance, do you think if we don't identify their communication preference, do you think we're able to communicate with them people properly then?
No way, we can't be able.
You can't, can you?
No.
No. You have to review it every time. Why do you have to have a reviewing the communication needs all the time?
Because you need to deliver the right care to the right
Yeah,
person.
yeah.
Yeah.
And especially, I mean, they've given an example on that slide. It says if you work with someone who's got dementia, their
Yeah.
understanding may deteriorate. You may need to keep telling them all the time
Yeah.
because that person might forget. So when working in health and social care, it's really important that good communication is essential in ensuring dignity in care. It's important that people have time to express their needs and preferences, and that staff understand the person they're supporting. It's vital staff develop other ways of communicating. The people who have a cognitive impairment, or they may have limited speech, or they may have, they may be having dementia or something like that. So you need to make sure you are building that trust. So you are identifying what their communication needs are, but you are also not moving away from that because you are taking on board what they are saying. And especially if they have special needs or anything, it's difficult. So there are different ways you can assess your individual's needs. So it's really important to assess your individual's needs. And you can use questions, observations, so ask the individual. It's really important you talk to the individual and tell them how they prefer to be communicated to. You should have that conversation with them, because they're the ones that you're going to communicate with. So you need to be able to identify what they find easy to do, what they find difficult to do. You as an individual need to, be there for that person. So you are going to speak to that person and ask them what methods they prefer. It may be easy for me and you to say this is a good method for you, but they may not prefer that. So, you need to identify that with them. Okay. You need to observe the individual. So you may be possible to determine their body language, why they want to do that. Observation is really good in regard to, watch them interacting with others, their body language and, how they respond to others. Noting, it's really important that you note down any non-verbal cues or communication difficulties, and then you're there to change that and assess that on the basis of that individual's needs. The next one is ask other key people. So, ask other people, the caregivers, talk to their families, talk to their other caregivers, to gain insight onto the individual's needs and habits, what they want. They should be aware of it, especially family. And if there's a care worker that looks after the person, work with them, talk to them. Another one could be read the individual's file or care plan again. Make sure you are looking at the individual's care plan, what that says, their passport, a communication guide passport to identify what that says. Make sure that you are able to identify what their needs are, because if you can't identify their needs, you are not evaluating what they communicate, how they communicate. And, that could cause a lot of problems because, your whole point of this is to ask direct questions, assess their comfort level as well, always ensuring that you are actively listening to that person and respecting their choices. we are there to respect their choices. It's sometimes, people think, oh, you have this communication need, you have this communication needs. You need to understand the individual. You need to make sure that you are understanding their needs, making sure that you are putting that into place and having conversations with them to understand that, because it's so important. So compare and contrast the approaches used when promoting effective communication. So you've got the different approaches used, which we talked a little bit about yesterday. So you've got things like verbal communication. Do you remember any of the ones we went through yesterday? The different types of communication. Esperance or Vida? So we went through verbal communication. What else is there?
No verbal.
Non-verbal communication, yeah.
Your body language.
Body language, yeah, yeah. Non-verbal cues, we could have verbal important. So we've got verbal, which would be things like, being able to speak to the person slowly. So your tone of language, that you're gentle and reassuring. Your volume, ensuring that you're speaking at a volume that suits the individual, especially if they've got a hearing impairment. Your clarity of speaking in verbal, and then you've got your written one as well, and that's letters, emails, or flashcards. Non-verbal is your body language, your facial expressions, your gestures, your touch. The use of interpreters, and that is someone who speaks on behalf of them. So you will have interpreters that will help build that rapport. Communication aids, so technology in the use of pictures and it may be braille, sign language or Makaton, and we'll go through each one in more detail. So verbal communication is the next slide. So what is verbal communication, Esperance? What is verbal communication? Is that speaking to someone?
Yeah, anything that involves speaking.
Yes, and conveying information. So verbal communication involves the use of like spoken words to convey information, maybe ideas and emotions. It's most common form of communication used in health and social care settings, and it can make different forms, including maybe face-to-face conversations, group discussions, and telephone calls. So it could be you need to be careful what vocabulary you use, your language. Why is that so important? What language you use?
To be more respectful and not
Yeah.
offend other people.
Yes, but does everybody understand maybe health jargon, health languages? They don't understand it, do they really? They may not understand that. So you need to vocabulary, use your the right, avoid using any sort of jargon. What about your tone of voice? Why is that so important? How you speak to someone, is that important?
It's very important.
Yeah, because you could be in a bad mood and they could sense that, couldn't they?
Yeah.
Yeah, so it's really important in regards to that. And then we've got the pitch of your voice, how you pitch your voice across. Some people may not respond well if they've got trouble hearing. The volume as well needs to be adapted. Some people, if they don't like people talking really loud to them as well. So your voice needs to be adapted. And listening is a big part of communication. You need to make sure you are actively listening, nodding your head, making facial expressions, making sure that you're a good listener and the person is able to talk to you. That's really important in listening to someone. So in summary, they be prepared to repeat what you said if person doesn't understand, be prepared, because that if it's an elderly patient, it's going to be really hard for them to understand. So you need to cater that communication around the individual's needs and make sure that they're able to understand what you are saying to them, because it's so important, that the individual is able to take that on board. The next one is active listening, and active listening is really important in any profession. Mainly in health and social care profession, it's really important and it plays a crucial role within that. So it involves things like, where you are listening to the individual, you are actively listening to what they are saying. You need to, is key communication skill in health and social care profession, and it's you paying attention to what someone is saying and responding to them. And it's important for building that trust and understanding between patients and clients. So you're able to build that trust between them, and you need to make sure that you are listening to what they are saying, and you need to also involves not only hearing words but also receiving, interpreting, and your full attention is given to that person. And the way you sit sometimes is really important. And the acronym that they've used is the acronym of SOLA, okay, where you sit squarely facing the other person. The S, open, the O is maintain an open posture. The L in SOLA is lean towards the other person. And the E is the eye contact. And the R is the relax your body language. So you have a relax, so you're listening to that person. And this is a key skill taught to counselors, to how you sit and how you, and it's an effective way, is the SOLA, of listening to people in general conversations. And it also includes the use of touch and importance, so it's really important in communication. It's a non-verbal communication technique that helps people actively listen to others, and it's often used, like we said, in nursing and other professions as well. The next one is written communication. Why do you think written communication is so important? Why do you think written communication is so important? Esperance again, or Vida? Anyone? Why do you think written communication is important? Is it important to keep records of everything?
Yeah, it's very important because you don't get to lose the information about the
Yes.
patient
Yeah.
and everything.
You
And
have that
keeps,
information, so if someone's talking to you, you've got that information straight away.
Yeah.
So written communication is a vital part of health and social care for sharing information, creating records and communicating to other professionals. And it could be things like emails, reports, care plans and medication plans. Writing everything down if someone is unable to hear or unable to speak can be a useful tool. So written communication helps ensure that all relevant information is documented and accessible as well. And it helps ensure that everyone involved in a patient's care has the same information, not that if someone doesn't understand. Written communication also helps ensure that legal requirements are met, and they can be, and also it's easy to share with people, and it's convenient at their own time as well. And it could be one of the methods is written communication, including non-verbal and verbal cues as well. And it's a crucial part for maintaining any sort of accurate care plans and put in place and providing information to other professionals. Non-verbal cues is the next one. So non-verbal cues, when we talk about non-verbal cues, it's things like, the behavior of the individual. So, you have non-verbal cues in regards to the element of, it's really important, is non-verbal communication, especially when someone struggles with verbal communication. It includes things like body language, your facial expression, your gestures, so it could be elements of that. So for example, body language, use open and relaxed postures to help the individual feel at ease. Your facial expressions as well, smile and maintain friendly expressions to convey understanding and empathy. Your gestures could be things like use hand gestures to illustrate points and convey meaning. Eye contact, ensure appropriate eye contact. Avoid staring too much, but do maintain some, form of engagement with them. You don't want to be looking at them too much so that they get a bit, off-putting, but, make sure you can, maintain the eye contact. Another important one is the tone of your voice, and that's really important when it comes to how you pitch your voice, and it can affect a message being received. When you are taking into account non-verbal communication, you need to be aware of the cultural differences, because some people, like we said, don't like the form of being touched when we looked at learning outcome one. Ensure noble, avoid any sort of inconsistencies. And it could be for non-verbal communication, there are some benefits. It can provide comfort and reassurance if someone just finds out they've got an illness. If you're there, you're able to support that person, and make sure that that person is, comforted with what you've said. But some people, again, taking into account cultural views of some people, it is, some people may find it inappropriate. Whereas, it could be nodding your head, just listening to that person. And that, smiling at that person makes a world of a difference. So, your body language could play a big part in it as well. So in summary, body language, it's important that your body language, as we mentioned, is different for different cultures. Because culturally, some people find it quite offensive if you want to shake their hand or if you want to touch them or anything like that. So you need to take that into account. You need to be observant of different cultures, maintain that respect for culturally, because people, would find it quite offensive. So you as an individual need to maintain that. Touch again, when we talk about touch, non-verbal cues, touch is one of the elements that's, does everyone like being touched when they find out about something? If they found out they've got an illness or something like we mentioned, does every person like to be touched? Esperance, do you think every person likes that touch?
No,
No. Why?
because it can be an offense to some cultures.
Yes. It could be an offense. It's how you touch that person as well sometimes, so some people may think it's good, but some people, it may be an offense, it may be a cultural thing. Gestures also useful for communicating. So, for example, if you point to an object, and the behavior is another nonverbal way to communicate. You can often tell whether someone is happy, sad, if it's an elderly patient. So their behavior plays a big role in it as well. So use of interpreters, body language, the use of interpreters. So interpreters used to facilitate communication between or advocates between people who do not share a common language by accurately translating spoken or signed words, while advocates are used to represent and support someone's interest, often by explaining complex information to them. Especially navigating systems and speaking on their behalf, especially when there may be a language barrier that requires interpretation, as well as an interpreter focuses on translation, where an advocate goes beyond translation to actively support the individual's needs and rights. So, the use of interpreters is a big thing within healthcare professionals. You need to be able to interpret the language across. They are there primarily to translate words, while, as we mentioned, an advocate participates in communication. An advocate will be there maybe if there's issues with the care plan or anything like that, but an interpreter does not provide any sort of opinions or advice, whereas an advocate would. Interpreters are often used in healthcare appointments, legal proceedings, or community meetings where there are language barriers, while advocates may be involved in situations where someone needs additional support beyond just translation, such as navigating complex legal processes or advocating their rights within a system. So, an advocate is very similar to a lawyer in that they would, be using them to help them with extra support, whereas a interpreter is there and used quite often to provide a service for patients, carers, to understand each other because they don't speak the same language. So there's a need to have both in place in regards to it. So communication aids is another element of it. So there are various communication aids used and within health and social care. Tools and devices used to assist individuals with communication difficulties, including picture boards, communication books, alphabets, gestures, sign language, maybe things like, as we mentioned, symbols, it may be braille. They are different. Everyone has different communication needs. It may be pictures, visual aids, communication books, non-verbal communication, and individuals' needs, it needs to be checked in regards to what their needs are, that you would be able to provide the tools for. So you may be able to provide certain tools for individuals, such as, communication tools, like we mentioned, picture boards. It could be communication charts and alphabet charts. It could be apps that they could use to reduce any sort of anxiety or anything. Speaking aids, if people can't speak, the element of trying to help them speak as well. Speech generating devices. So, if they can't speak certain words, that would help them. So, there are elements of, communication does come up, in different forms. Communication aids are invaluable tools in health and social care. They help patients express, their needs and preference in promoting this understanding and personalized care. So selecting and implementing the right aids require assessment, collaboration, and ongoing support. Despite challenges, they benefit the patient and the quality of life. So providing these tools is really, really important. Sign language and Makaton, and again, that's really important in regards to people that a way of communicating with someone. When would you use sign language, Esperance?
To those who don't speak or
Yes.
don't.
Yeah, they've got a hearing impairment or they're deaf, okay? So these are two forms of communication. You've got British Sign Language, BSL, and you've got Makaton. So British Sign Language is the main language used by deaf people in the UK. It is a visual gestural language that uses facial expressions, hand shapes, and body movements to communicate. BSL has a different grammatical structure to spoken English, so you're enabled to speak English and communicate with BSL at the same time. British Sign Language is similar to spoken language in one way, and that is how it was adopted regionally across variations of the UK. BSL variations are spoken accents, so there are some signs in certain areas of the country that are not often used elsewhere. And then we've got Makaton, and this was introduced in the 70s, and it's a unique language that uses a combination of speech, signs, and symbols to help people improve their communication skills. Makaton helps them develop all essential communication skills, such as memory, recall, maybe comprehension, attention, and listening. The communication language uses signs and symbols alongside speech in spoken word order. And this provides extra clues about what the person is saying or helping them to achieve clarity. So make sure what they are saying. And here in Makaton, signs and symbols used together can help individual speech if it's unclear or who have no speech as well. So it's really important to have these aids in process. Makaton is mostly used in the UK. However, since its inception, it's adopted in more than 40 countries around the world. So it's quite widely used now as well. And it has two vocabularies, a core vocabulary of 450 essential words, signs, and symbols as the foundation of the program. And the second one is open-ended vocabulary, which provides further signs and covers broader life. And the link there to them is just there, so you can have a look at how Makaton works. So 2.3 describes services and resources access to promote effective communication, and this one looks at the first one, verbal, face-to-face, and the advantages and disadvantages and when it can be used. We've got the next one, which is written, which is the advantages and disadvantages and when it can be used as well. So have a look at that in your own time. We've got it for non-verbal as well. We've got it for interpreters, the advantages and disadvantages of interpreters and advocates, why there's a need to have them and why there's a need to use them within the health and social care profession. And then you've got also communication charts, books, pictures, exchange communication system, why the advantages and disadvantages of that, symbols and pictures, and also look at elements of speaking aids, sign language, and Makaton. When we talk about communication aids, why is it so important to use them, Esperance, within the health and social care setting?
Use what? Sorry.
Why is it so important to use communication aids?
To make sure every patient can communicate,
Yeah.
or one can communicate to the healthcare providers.
Yeah. So not every patient can communicate effectively, can they?
No.
So they need certain aids, they need sign language, they need Makaton, they need Braille. These are the things they need to help and support them. And also, it's we use these everywhere we go. There's signs up for people who have speech and language problems, hearing impairments. So we have to communicate properly, and we have to make sure that we are communicating in what the person wants us to communicate. The next one is 2.4, services and resources to promote effective communication. So to promote effective communication, individuals can access services like speech and language therapy, maybe interpreter services for language barriers. Also, counseling for emotional communication challenge, online communications, books, and boards, for autism, maybe ADHD, cancer, dementia, courses as well, that will help as well. Workshops, and seminars and support groups to participate for a safe environment. So, you have elements of these, and there's some links there. England, NHS, UK for interpreters, advocatepeople.org.uk, autism and communication, and then the next one looks at elements of picture exchange system, what that's for. Speaking aids, living made easy, giving information about any sort of speaking aids. Makaton, you can find Makaton. In addition, when we've looked at it, you can have speech and language therapist, and they're there to assist you with articulation, fluency, and understanding language difficulties. And you have audiologists where if you've got a hearing problem, they're able to help you with hearing aids and things like that. So, there's a need to have them in place. You have support groups, and support groups are so helpful for individuals because they help them come together in groups and also, sit together and speak about things and also speak in a safe environment. There are national support groups and local support groups, maybe on issues of dementia, cancer, Alzheimer's, that you could join and you could help, support each other. Do you think support groups work for people? Do you think support groups work?
Yeah, they do work.
Yeah. Do you think people feel at ease when they're talking to someone who's in the same position as them?
They feel relief.
If someone is, in the same position as another person, do you think they feel comfortable talking to that person?
Yeah, they feel
Yeah.
more
Yes.
comfortable and more.
Yeah. So if someone's got, Alzheimer's or anything, they are able to talk to another person who's got Alzheimer's, and it makes them feel comfortable, and it also makes them feel part of a group, and it makes them feel that people are listening to them. So, you as an individual, there's a number of key experts in speech and language therapy, I've just mentioned, interpreters, counselors, but if they're part of a group, it also helps them befriend other people, but also makes sure that they are being supported, and being part of a network and a group is the way they can get information. They can look at, what's helping that person to help them. So there's some alzheimers.org.uk, Royal Institute of Blind People, which supports people with sight loss, and rnib.org. Information on the internet is really important as well. Sometimes people use the internet too much for information, but it also can give you basic details about maybe certain illness or a certain medication or anything like that. So the internet has played a big role in changes in life, and it supports effective communication. People want to use the internet to help them. I know sometimes internet is not always the best thing, but it does help with certain concepts around what the person is able to understand. So if they need that extra support, use the internet. So in this section, so just to clarify that we've finished learning outcome 2 now. In Learning Outcome 2, we've looked at elements of understanding the communication needs and preferences of individuals. We've looked at how to assess communication and to promote communication needs. We've looked at the effective communication, theories of effective communication we've looked at. We looked at the linear models, the interactive models, and the transactional models, and how they play a role in effective communication and how people use them to communicate, because there's different preferences of different roles used within an organization. We looked at also the importance of determining individuals' communication needs and preferences, ask the individual, observe the individual, verbal communication we've looked at, non-verbal communication, active listening, and we looked at the SOLAR model that's used, the acronym, written communication, non-verbal, body language. We looked at the use of interpreters or advocates, why that's so important, and also communication aids. So we could have communication charts and books, picture exchange communication system, PECS. We looked at Braille, symbols or pictures, and speaking aids as well. We also looked at sign language or Makaton and the importance of that, how widely that is used within countries as well. We looked at elements of services and resources to promote effective communication, and we looked at some links there as well. We also looked at elements of speech and language therapists, why they are used quite a lot, audiologists, and also the use of the aids that are provided for communication, and the whole point of having groups for supporting individuals, so support groups and networks and how they support individuals. So these are what we've done in today's session. References, what we've used, you can link onto them if you need to get any sort of more information on them. Refer to ebooks and journals on Moodle for this unit. This Learning Outcome 1, which was yesterday's, and Learning Outcome 2 will be recorded and uploaded onto Moodle. There's some further reading on Moodle for you. The links are there, communication with people with learning disability, and the link is just there for you to have a look at, read at the article. And 3 must have communication skills for health and social care as well, and the link is there as well for you to have a look at. If you need any sort of additional reading or anything, that is available on Moodle. Have you got any questions before we finish the session? Esperance or Vida? Any questions, anyone?
No, thank you.
Thank you. Thank you for attending today's session, both Esperance and Vida. And if you have any questions or any sort of queries, please email learnerwork@ukvarsity.co.uk. Let me just check. Esperance has put something in the chat. Just 1 minute. No, please. Okay, thank you, Esperance and Vida, and thank you for attending today's session. Again, if you have any questions, please email learnerwork@ukvarsity.co.uk, and all the resources that we've looked at today. There's also some other these are the articles that I want you to read, which I'll show you in the next session. You can have a read of them, but these 2 articles that are there for further reading will help you establish things. The recordings for both Learning Outcome 1 and 2 are on Moodle. Thank you for attending today's session, and I will see you in the next session. Thank you. Bye. Bye, everyone.